John McCain, an icon and American hero, now facing a tough battle, an aggressive form of cancer. Coming up, we'll talk about the type of cancer he has, the diagnosis for this great American.
John McCain diagnosed with brain cancer this past week following a procedure at a Mayo Clinic in Phoenix. So what is the diagnosis for the senator going forward as he hopes to return to Capitol Hill? Dr. Singh Sahni is medical director of neuroscience at the Sarah Cannon Cancer Institute at HCA Healthcare's Johnston-Willis Hospital. Dr. Sahni, thank you so much for joining us. We're very concerned about Senator McCain. And before we start, I want to let you know that we are waiting for Vice President Prince to speak at the Ohio State University. If that happens, we will have to dip into the Vice President. So thanks for your patience in advance.
Thank you very much.
Sure. If you could start, Dr. Sahni, by explaining to us what is it glioblastoma? What causes it to form? Is everyone susceptible? You know, can anyone get it?
So glioblastoma is a malignant form of brain tumor. Roughly about 2 to 3 people in 100,000 in U.S. can get it. Actually, it's only about 10 to 15% of the brain tumors. Majority of the other brain tumors are much better treatable. And glioblastoma is formed from the cells called the astrocyte. Glia in Greek means glue. The cells in the brain, the neurons that get connected with these astrocytes. Astrocytes are the best friends forever for the neurons, but they sometimes can go rogue. And in brain, usually the tissue, the cells die and the body gets rid of them.
No? Do they regenerate, or the body just discards it, you're saying?
The body makes new cells, but there's a proportional rate of cell formation and getting rid of the debris. When the debris doesn't get away and start piling up, and these new cells start independently coming up and growing at a rapid rate, you have a brain tumor. Now, not all of them are malignant, but when these cancer cells go in them, then it's a cancerous tumor. That's called a glioblastoma.
Oh, thank you for explaining that. I mean, it's definitely complicated, but I appreciate your breaking it down for us so we can understand it. As it specifically relates to Senator McCain, how did the tumor form? And tell us about treatment and its success rate.
So Senator McCain's glioblastoma was right above his left eye. As we heard initially, they said he has a bleed. I have a little model here. I was going to show you this. Right around this part of the brain called the orbitofrontal area. That's why they made an incision right above his eye. And that initially did not bleed, but I think as he bled and hemorrhaged, he became more symptomatic, and the doctors at Arizona indeed did an excellent job. And from the news we've heard, they did have a nice complete resection. But unfortunately, glioblastomas, you cannot completely resect them because they have these tentacles in the normal brain, and even if you have a complete surgical resection, there are still cells that are sitting there. But then you treat them with radiation and chemotherapy, and nowadays we have additional treatment, targeted treatment with immunotherapy. And I think in Senator McCain's case, he had a very good surgical resection. So although the prognosis is slim, in general, if you talk in generality, you talk about 2 years or so for survival, but there are people who are living 10 years, above 5 years, depending on some very specific molecular markers. And his location was a good location to get a long-term good prognosis.
Well, that's encouraging regarding Senator McCain. Finally, doctor, are there certain symptoms? You know, how would one's doctor know how to find this or discover it? What do you say to the doctor? I've got a headache. What is it?
So a lot of time you might find something so subtle that the family might pick it up. Behavioral changes, speech problem, vision problem, balance problem. So anything that is neurologically changed. For example, we did see some of those subtle deficits and kind of a speech impediment with Senator McCain that kind of gave you a clue that something in the left frontal lobe is causing some problems.
How do you know it's not a stroke?
Well, you don't. That's why you do imaging. Not all. Now, stroke, one thing is can happen immediately. But the gliomas and other tumors, you have a very slow progression. And there are patients who might go through completely unrecognized, and if they're being imaged for a totally unforeseen reason, you might see they have a brain tumor.
Well, Dr. Singh, Sahni, I appreciate your time this afternoon, sir, and your expertise. We have to go now, but thank you very much for explaining.
Thank you very much.
And we'll have you back again. Thank you, sir.
I appreciate it. Thank you very much.
Take
And
care.
our thoughts and our prayers and best wishes, of course, are with the senator.
Absolutely.